January 29th. And we're just reconvening to briefly, or not briefly, not sure. We have Lead Council with us. We're going to discuss H35, no, 31. And I'm sorry, it's been a long day. H31 and possibly vote on this. So,
good afternoon, Jen Carby from the Office of Legislative Counsel. So yes, we just did H35. I pulled up the wrong one when I sat down to. We're going to look at H31, which we have walked through before, but I will just give you a reminder. So this is an act relating to claim edit standards and prior authorization requirements. And this is making a couple of clarifications or minor changes from legislation passed last year. The first one has to do with the edit standards. So the edits that insurers and other payers can make when they're processing claims. The legislation passed last year created some specific edit standards that had to be applied in most circumstances, but had some exceptions. And so this is adding an exception that adherence to those edit standards that are not shown but specified in subsection B is not required. And this adds a new number 3, when adjudicating claims for healthcare services that were delivered outside of the state of Vermont, unless the payer and the out-of-state provider agree that one or more of those edit standards will apply. And we talked some about this. We typically do not try to regulate what happens outside of the borders of Vermont. We generally don't have the authority to do that. And so this is really clarifying that that if the services were delivered outside of Vermont, Vermont's claim edit standards will not apply. But then there's always that ability for the payer and that out-of-state provider to agree that actually some of them would apply. That would be a contractual issue. And then section 2 is amending language passed last year that exempts primary care providers' orders for services from prior authorization requirements in most circumstances. And there was a definition provided of primary care provider, and it said it had the same meaning as used by the Vermont Blueprint for Health. There wasn't a common understanding of what that meant, so this would be modified to say that it means a healthcare provider who is contracted and enrolled with the health plan as a primary care provider, which seemed a little repetitive, but basically what it's saying is for our purposes of who is going to be exempt, who the health plan has to exempt, has to not impose a prior authorization requirement for anything ordered by a primary care provider. Who do we mean by primary care provider? Well, we're telling the health plan it's whoever you have contracted and enrolled in your plan as a primary care provider. That's who you have to not impose any prior authorization requirements on. So it actually makes it much more straightforward for the payers, the insurers to implement. And then section 1 about the claim edit standards takes effect on January 1st, 2026, which is when the claim edit standard requirements go into effect and the other exemptions go into effect. So it's consistent there. Section 2, that revised definition of primary care provider for prior authorization purposes, would take effect on passage and be implemented by all health plans as soon as reasonably practicable after that date, but in no event later than January 1st, 2026. I think you heard some implementation issues from both payers and providers. So that's why the language reads the way it does. And then the effective date section would take effect on passage.
anyone have any questions?
Can you just explain how this affects emergency care? Those clinics, express care, or what?
The urgent care centers. It would only affect services provided by an urgent care, and only section 1 would affect services provided in an urgent care center, and it would only be for out of state. The only effect of this bill would be for out of state urgent care clinics providing services, and just saying the claim edit standards would not apply to those out of state services.
So
I suppose it's possible if you had somebody working at an urgent care clinic who was contracted and enrolled with a health plan as a primary care provider, then there could be the prior authorization exemption for that provider, but that would really be based on the way that the plan has identified the provider.
So what that means to me is if I go to the urgent care clinic, there's no prior authorization for anything to do for me.
I don't believe that's accurate. So, and it all has to do with whether the provider who you see in whatever setting, so it doesn't treat urgent care clinics any differently from any other type of setting where healthcare services are delivered. It's really about whether the individual provider is contracted and enrolled with the health plan as a primary care provider. I don't know how individuals who practice in an urgent care setting are identified by health plans. That's a question you can ask the health plan. But it's not treating them, and it's not differentiating urgent care clinics from any other setting. It's really about the type of provider and how they are contracted and enrolled with the plan.
So if they're associated with a hospital in Vermont, something like that, to be okay.
Again, it depends if that individual provider is considered to be a primary care provider by the plan.
Okay.
Will there be any burdens on insurance companies or the providers?
It could depend who you ask. A lot of this is, section 1,
Yeah.
no, I believe this is all out of state, so it's not affecting Vermont providers. And this is something that my understanding is Vermont payers wanted. Section 2, the not imposing prior authorization requirements, you will hear from different stakeholders in the healthcare system, whether prior authorization requirements are a good thing or a bad thing. This provision by itself doesn't do anything except provide clarity to which providers we're talking about when we say primary care providers. The health plans, I believe, support the idea of this amendment because they are familiar with which providers they have enrolled in their plan as a primary care provider. The effective date for section 2 maybe is the biggest sticking point between payers and providers. The providers would like it to take effect or to be implemented by plans as close to on passage as possible. The plans say they need more time to implement it. So we've kind of tried to split the difference there a bit with the effective date by saying, let's get this moving, but recognizing it may take some time. So that's why there's the drop dead date of January 1st.
Yeah, Woody.
This is just for primary care provider.
The prior authorization exemption, yes. And it's only for certain types of services as well. I believe it does not apply to prescription drugs. There's out of network. I'd have to look at the actual
And
statutory language.
and it has nothing to do with, say, emergency transportation for services out of state or
No,
anything like that.
no,
Okay.
that's, as I understand it, beyond the scope of section 2. Again, section 1 relates to claim edit standards. So it may depend what type of service was offered. And if it took place in part in Vermont, there may be some overlap there, but not treating that any differently than any type of other care under the plan.
So you see your primary care provider, you have an examination, and let's say something comes up or something's found. Maybe you have a heart issue or something, and they refer you to Dartmouth. That's worked out between your insurance, and therefore, there's no, I don't know,
Prior authorization.
May I-
prior authorization required.
I don't think that's a referral doesn't mean that the provider has ordered anything. So under the statute, and I'm just trying to look, so a health plan cannot impose a prior authorization requirement on any admission, item, service, treatment, or procedure ordered by a primary care provider. Primary care provider saying you should really go see a specialist at Dartmouth, and then you call and make an appointment with a specialist at Dartmouth. The primary care provider is now out of the equation. There's no relationship between what they did and the actual service you received at Dartmouth. So there, and the carve out does include prescription drugs and anything provided out of network. So if a primary care provider orders a prescription drug for a patient that is not automatically exempt from the prior authorization requirement. That's what I had to.
Or if they referred you to service at an out-of-network provider, that also would still require prior authorization.
Right, but referrals, if the referral doesn't exempt anything either. So let me put the language back up now that
I think Alan had another question.
Oh, I'm all set.
Okay.
I will ask.
Go, please.
The prior ops that we did last year, the insurance companies right up to are taking care of all that, or there's still issues?
are they doing it? So my understanding is that there was some confusion in the rollout of the definition of primary care provider. So I think they are doing it to some degree, and I'm looking to the chair because I think she's part of more conversations than I was.
So there was I think there was some confusion around the definition of what a primary care provider was that was considered exempted from this. I believe that the Department of Financial Regulation gave guidance. Everyone has been compliant as of January 1st with the guidance that the Department of Financial Regulation gave. And that was that the primary care provider was a blueprint for health primary care provider. So
Participating in the
they
blueprint.
had to participate in the blueprint for health. So there was concern that there are primary care providers within our state who choose not to participate in the blueprint for health. And they are not exempted currently. But that is the current practice as of January 1 of 2025.
Subset of primary care providers who are enrolled who are participating in the blueprint for health should already have, it sounds like, the prior authorization exemption in place. And those primary care providers, as deemed by the plan, who are not participating in the blueprint, who may still be coming online for that.
There was a working group on this, and it was, the agreement was that instead, that what it would be that when a primary care provider, when any provider decides to enroll in an insurance plan, they contract with that particular insurance. And at that time, they actually designate whether or not they are a primary care provider. So it decided that this would cover, so when a primary care provider enrolled with that insurance, say for instance, MVP or Blue Cross, they designate themselves as a primary care provider. And for the purposes of the exemption for prior authorizations, that is who would be exempt.
This doesn't change any of that.
This bill makes it so that it's who the provider is contracts and enrolls as a primary care with that insurance.
Who the payer?
Yes.
But if they go outside the network,
They go
it's a different story.
right. There's no requirement
No requirement.
that the insurance exempts a provider from primary care, from prior authorization if whatever the person is being referred for or ordered for is out of network or as a prescription.
Brian and then Topper.
And that would mean that the payer and the provider's contract would determine that arrangement. So we're not touching that. Like a payer could contract with providers out of network to not have prior authorizations if they choose.
Well, once they're contracting with a provider, typically it's the provider is joining their network.
There are cases that I've been in where the payer doesn't have providers in Vermont and it's a case by case contract. That's why I brought that up. So like what I'm getting at is that we're not excessively limiting the ability of payers and providers to do business outside of the network.
Don't believe so.
Okay.
I'm not.
Yeah.
Act 111 only applies to providers that we actually have authority over.
Insurers.
Insurers.
Yep.
Yes, payers.
Yeah, we're only talking about Vermont regulated.
So those out of network they're not subject to this.
They're not even subject to this if we are in your network plan.
I guess I'm not sure.
Yeah, I'm not sure either.
Okay, we're regulating from the providers or the insurers that Vermont has regulatory authority over. So the commercial insurers over which Vermont has regulatory authority. If there are outside of Vermont payers who have relationships with inside Vermont providers as part of their network, we are not regulating the insurers who are not subject to our jurisdiction.
Is it because of ERISA?
It's because we can't regulate outside. I mean, we don't have any regulatory hook for somebody who's outside of a payer who's outside of our state. So no, that's not an ERISA issue. That's a sort of extraterritorial jurisdiction issue. We can't reach outside of the state and regulate people who are not subject to our regulation.
Pepper?
Physicians group. They're in favor of this?
I cannot speak for.
They were part of the stakeholder group.
They're in favor of it.
They spoke to us. Vermont Medical Society testified and was in favor.
Yeah.
Any other questions? Yes.
I have to say this was much clearer at the beginning of the day.
I probably should have postponed this till tomorrow, and I'm sorry, because today was a really, really long day.
It was.
I acknowledge that.
So I put the statement of purpose of the bill as introduced by us. It's at least a more plain English version.
Yeah.
So again, the bill would specify that otherwise applicable health insurance claim edit standards, the way that health insurance claims are edited, do not apply when the service is delivered outside of Vermont, except we let the payer, the out-of-state provider and the insurer make whatever agreement they want. It would also modify the definition of primary care provider for determining which healthcare providers' orders are exempt from prior authorization requirements. And again, we're putting it back to the insurer and say, if you've contracted with the person as a primary care provider, then you have to exempt them from prior authorization requirements.
Yes.
I
I'm
don't
sorry.
recall there being anyone who was in opposition to this.
I don't recall there was anyone. We took testimony from VAS, the Hospital Association. We took testimony from Vermont Medical Society. We took testimony from Bi-State Primary Care. We took testimony from Blue Cross Blue Shield of Vermont. We took testimony from MVP. We took testimony from Cigna. Those are the three plans that we regulate.
Blue Cross Blue Shield too.
Blue Cross Blue Shield, MVP, Cigna.
Didn't you give a last call too, like 2 days ago?
I did
Yeah.
give a last call. We gave a whole weekend for the last
Yes.
call
Yeah.
and an extra day. And I have heard from no one opposed to this. We also took testimony from the Department of Financial Regulation. And Legislative Council, obviously.
Thank you. That was helpful.
So
Did you?
Do we need a motion?
I move that the committee approve H31 as introduced.
Second.
Approve it or vote it out of committee?
We usually say approve.
Okay, I don't remember.
With the clerk,
second.
I think Leslie
Third,
seconded.
but that's great.
Oh, who did the second?
Leslie.
I'm sorry, Leslie. I was waiting for somebody to do it.
Will the clerk call the roll?
Representative Chino. Representative Cordis, yes. Representative Critchlow.
Yes.
Representative Demar.
Yes.
Representative Goldman.
Yes.
Representative Houghton.
Yes.
Representative Page.
Yes.
Representative Powers.
Yes.
Representative Rebecca.
Yes.
Representative McFawn.
Yes,
And Representative Black.
Yes.
The motion passes on a vote of 11-0-0. And Representative Black is the reporter.
I'll be reporting the bill, so if you could send me.
You want any hints?
Penny.
So I think we're done for today.
Yeah.
Can't wait to hear you do your second.
And we will see, we're still alive.
Yes.
Yeah, get back in your chair, decorum.
So thank you, everyone. Thank you, everyone, for your attention today. And it was a long day, sometimes emotional day. So
Yeah.
thank you so much.